alert for falls. They are the second leading cause of accidental death, exceeded only by motor vehicle accidents. What does one do on arriving at the scene of an accident, not knowing what happened? First, remove hazards to the victim and yourself. Then, assess the situation. Find out what happened. This may help you to anticipate injuries. Examine the casualty. If she is conscious, ask her where she hurts and examine that part first. Determine the extent of the injuries. If there is bleeding, control it. Call for help if it appears you will need it. Do a thorough examination. Start at the head. Then the spine and trunk. Handle carefully but firmly enough to feel bleeding, swelling, or deformity. Examine the upper limbs, even if there is no outward sign of injury. Examine the lower limbs. If there is tenderness or a bruise which may indicate a fracture, steady and support the injured part. Be careful not to cause further injury if you must move the casualty. Give appropriate first aid for what you find and what you believe may be wrong. When a casualty is unconscious and the reason is not obvious, your task is more difficult. Check first for breathing. If absent, give artificial respiration. If the casualty is breathing, make sure that his airway is kept open and clear. Loosen clothing at the neck and waist. Send for help. When adequate breathing has been assured, check for serious bleeding and other injuries. Give appropriate first aid for what you find. The general condition of the casualty may help you to determine what caused the unconsciousness. Feel the skin and note its color. Is it hot and dry, cold and sweaty, pale, flushed, or bluish? Check the wrist pulse. Place 3 fingers over the artery at the wrist and press gently against the bone. Do not use your thumb. If a pulse cannot be located, check the neck pulse. Locate the Adam's apple with 2 fingers. Then slide the fingers to the side of the windpipe and feel the carotid pulse deep in the neck. Do not leave an unconscious person unattended. Stay with the casualty and keep him in the best possible condition until help arrives. When help does arrive, be ready to tell them what you believe to be wrong, what first aid has been given, any changes you have noticed in his condition, especially any changes in the level of consciousness. So much for a single casualty. Now let's look at that motorcycle accident again. In highway accidents, multiple injuries to one or more persons are common. In such situations, priority must be given to each casualty in accordance with his needs to preserve life and prevent further injury. Breathing problems, bleeding, unconsciousness, and severe shock must be dealt with first. Send someone to stop traffic and get help. Remember that air passages blocked by blood or vomit kill many who would not necessarily die from their injuries. Proper positioning to keep the airway clear could save their lives. Assess the needs of each victim quickly as you find them, but do not interrupt your survey of all victims to treat minor injuries. Ask conscious victims how many were involved in the accident. Make sure you find all of them. Do what you can with the material you have to reduce the effects of injuries and prevent further damage. Control bleeding. Stabilize fractures. Priorities may change as you are treating the casualties. Be alert and watch for signs that casualties may be more seriously injured than you had originally suspected. Remember that the signs of internal bleeding and shock may develop slowly, but both conditions require urgent medical attention. You may never be able to do all you would like to for the victims. Some less urgent injuries may have to go untreated. When the ambulance attendants arrive, telling what you know will help them to determine the priorities for medical care. Internal injuries and head injuries before simple fractures. You will learn more about emergency care of the injured at the scene of an accident in a workbook lesson which follows.